I want to welcome our next speaker, Dr. Jasmine Blocker. I will take this time, I'll let you kind of take over and share about what you do and your experience.
Thank you, Michelle. I'm Dr. Jazz. I am a pediatric physical therapist. I have been practicing for going on 3 years now. And I started working in South Carolina, where I worked with the early intervention patient population, school-based pediatrics, and outpatient pediatrics. And then I started a career with travel pediatric physical therapy. So I moved to Arizona and I was working on a Native American reservation for 3 months doing school-based pediatrics there. And then I ended up in Maui for my next contract. And I work in outpatient pediatrics here. And also, I do a couple hours out of the month at a skilled nursing facility. So I love learning. I love working with different patient populations. And I love educating people. I also have a book titled 2.76 that is available on Amazon. And it is about my journey throughout physical therapy school and how I failed out of PT school, but I kept going. I kept God first. I kept my faith first. And I ended up persevering and became a PT. And now, like how I said, I'm in Maui working. So,
I love it. Yeah. And then for your book, I think that's great because we'll have a lot of students who are going through that difficult journey, being afraid of maybe not getting into grad school or failing. So I think that's really good to share as well because it's not easy. It's not always we graduate or we make it, we apply, we get in, and then voila, here's our career. I think it's a little bit harder than that. And more people need to share that. So thank you.
thank you for that. Yes, appreciate
Yeah, of
it.
course. And then for the pediatric source itself, how did you hear about it? And then what did you love about it?
Yes. Oh my goodness. So I actually was searching for jobs on Upwork, and I was trying to do like freelance independent contract work. And I found Pediatric Source from there. And it was about creating a course educating healthcare professionals working in the pediatric field. And I was like, oh my gosh, this is perfect. Like, this is needed. I want to be a part of this. So I reached out, I applied, and we talked, I interviewed, and we both felt like it was a great fit. And I'm so excited for Pediatric Source because it's needed. And I work alongside OTs in South Carolina. I worked with SLPs and we work together. So I feel like it's important for us to learn together as well. So yeah, I'm happy to
Or
be a
yeah, I'm happy to have you. And I agree with everything. Can you take a moment and share about your topic?
Yes, yes. My topic is about the interdisciplinary approach to treating torticollis. So
Mm.
torticollis is when babies have a tight muscle in their neck and it causes them to look one way and tilt their head one way. It can cause flatness of their head, and it can lead to also causes of difficulty feeding, difficulty with asymmetries with their gross motor milestones and being able to hit those milestones. So it's I love treating torticollis. It's probably one of my favorite like conditions ever to treat because we use simple techniques to treat it, but they're very effective.
Mhm.
And also for torticollis, it's rare that I'm the only healthcare professional seeing that child. Like it's usually a PT, SLP,
Mhm.
lactation consultant, chiropractor. Everybody is on board to being able to just use our interventions to help the child and the family progress with everything that they may have impairments with. So that's my topic.
Yeah, it's really interesting. I wish we learned more about it as an SLP myself, right? Who wants to do a little bit more feeding and wants to get into the NICU. And I have young clients, like infants, sometimes, 10-month-olds. I wish I knew more about it
Yeah.
a couple years ago. So I think your topic is also really nice and needed and very informative. And
Thank
then, yeah. uh, Last question. What are you excited about with the pediatric source? Where do you hope to see it in a couple years from now?
Yes, that's a great question. I am definitely excited about collaboration. Like I said, I love working alongside OTs, SLPs, anybody in the healthcare field. And I feel like we definitely need a platform that focuses on pediatrics and a reliable source for people to be able to learn from and also share the knowledge that they may have and just continuing to grow with that collaboration. So years from now, is going to be more healthcare professionals involved with teaching and